Okay, well, on that assumption that we're working without cameras, I'll begin. It's the usual introductory script, first of all, which I have to go through. So, welcome, everybody. I'm Councillor Jason Zackley, Cabinet Member for Health, Wellbeing and Social Care. Please be assured we have put appropriate cleansing and social distancing measures in place to ensure this meeting is undertaken in a COVID-secure manner. Can I remind anybody that you're encouraged to wear a face mask covering when not seated and to maintain a social distance where possible. Please note the webcast for this meeting will be audio only due to a technical failure. As the meeting is audio only, please speak close to the microphones. If the continuous fire alarm should sound, please evacuate the room and public gallery by the stairwells. Do not attempt to use the lifts, and please assemble by Queen Victoria's statue in Guildhall Square. In order to comply with the Guildhall Trust Fire Marshal regulations, anyone who signed in at the Guildhall reception desk should sign out when leaving the building at the end of today's meeting. Members of the press and the public are also permitted to record the meeting on the understanding that neither disrupts the meeting nor records those stating explicitly that they do not wish to be recorded. Please can everyone use the microphones and remember to switch them off when they have finished. Now, I think I forgot this last time. I have to go around and do introductions, so I'll begin with myself, which I've already done actually, so forget that. Move along to Jeanette.
Councillor Jeanette Smith, PPP, independent member on this committee.
Councillor Kirsty Miller, opposition spokesperson for Labour.
Andy Biddle, Director of Adult Social Care.
Richard Webb, Finance Manager for Adult Social Care and Public Health.
Councillor Lewis Gosling, Conservative spokesperson.
And Matt Gummerson, Lead for Intelligence and Public Health, Portsmouth.
Anna Martin, Democratic Services.
Splendid. Thank you very much, everybody. Okay, there are no deputations, so we'll move on to item 1, which is apologies for absence. I've only had one apology, which is Joe York, the Managing Director for Health and Care at Portsmouth. Any other last-minute apologies? Nope. Okay, declarations of members' interests. Colleagues, do you have any interest to declare?
Yeah, and my normal one, which is I'm a paid official of Unison, but there's nothing on the agenda that precludes me from this meeting.
Thank you, Jeanette. Okay, item 3 then, which is the beginning of Andy's little spat. Adult Social Care Safeguarding Overview. Andrew.
Thank you, Chair. Good morning, all. So the purpose of the paper that's in front of you is to give both portfolio holder and spokespeople an overview of the Portsmouth Adult Multi-Agency Safeguarding Hub, commonly known as the Adult MASH, which is the safeguarding team at Portsmouth City Council for adults over 18. On section 4 of the paper, we highlight the statutory basis of the safeguarding function and give a broad definition of safeguarding for information. And section 5 provides information on referral routes into the team and the opportunity the routes of action open to the team in response to any referrals that they receive. Section 6 of the paper highlights the trends and themes in referrals and how Portsmouth as local authority compares against the national trends, and also includes some information on how the pandemic has impacted on safeguarding. In section 7 there's a case study given to illustrate how the team works with Portsmouth residents, particularly focusing on what people want from their safeguarding interaction with the council and personalisation. And then in section 8 we highlight the continual professional development role of the team and how the team's work is reported on. It's worth noting that the team, in addition to working to help people develop within the service, also provides training to members at various times during the year around adult safeguarding. And then the paper concludes with the links between the work that the Adult MASH does and the Adult Social Care strategy. As you'll recall, the strategy tends to govern all of the work that we do in adult social care in Portsmouth, and so all of the services that we provide and the work that we do should link back to that. That's a broad summary of the paper, but happy as always to take any questions.
Thank you, Andy. Colleagues, do we have any questions? We do, indeed. First of all, Kirsty, then Jeanette.
Okay, Thank you, Andy. Where are we at with the backlog of the safeguarding referrals, and will that impact on the current referrals coming in?
So the paper that we took, I think it was last calendar year, wasn't it, around PPN1s, the public protection notices. So we've conducted the exercise that we talked about in terms of reviewing a percentage of those. We didn't see any difference between the last exercise we conducted and this one in terms of the relevance. So the vast majority of them weren't relevant, weren't people that were eligible for social care or hadn't given their consent for their details to be shared. So we've set aside those referrals that we received over the past year that we said we would, and we've now started prospectively. So we've introduced a different system as of February of this year, whereby all referrals are reviewed on a daily basis and either set aside if people don't meet the eligibility criteria of safeguarding, or are actioned. So the backlog now for referrals is in double figures, but low double figures, and is reviewed on a weekly basis. So we're in a better place than we've been in shorthand.
Thank you. Jeanette?
Yeah, thank you. I'm always interested in how people, especially staff members in the safeguarding team, cope with the issues that they're dealing with. So how do we protect those staff, and what do we do to help them through some really complex cases and difficulties?
So it's a mix, really, of the corporate approach that we take generally. You'll be aware of all the wellbeing stuff that we do as a council, and we have, and I think this developed during COVID from memory, we have very regular wellbeing updates where we look at sharing experience from colleagues who have found particular ways to manage their wellbeing. In adult social care, we also, on a team basis, do individual team support. So teams have their lunch and learn sessions. They have their, in addition to their one-to-one supervision, they'll have group supervision and support. And where we've got a particularly difficult set of circumstances, there's one particular safeguarding inquiry we've been working with for a long time. There's very regular support provided to the team members that go into that particular establishment, and that's planning for what they're going to do when they go in, and then a wash up and support when they come out. Our manager for safeguarding, our team manager for safeguarding, is a very experienced individual both in health and social care, and so is very alert to wellbeing concerns of our staff and offers excellent support, but also as part of that continual professional development effort that we have, also offers support to other teams as the manager of the MASH, and when they've had particular difficulties and difficult circumstances. So it's not all planned support. Some of it is quite regular in terms of the wellbeing updates, and some of it is ad hoc depending on those circumstances, but very well aware of that.
Lewis?
Just on comparing us with the national data, do you know where we were before COVID? So has the jump above come since COVID, and we've seen a bigger impact from COVID, or were we always trending above?
We've always trended slightly above. Difficult to be precise as to why that is. I think we've got challenges within Portsmouth in terms of our communities and levels of deprivation and that kind of thing. So we have always tracked slightly above. The general impact of COVID that we felt, and I think this was echoed in some ways for our colleagues in children's social care, was a significant dip at the start of the pandemic, as everyone was getting to grips with how they were working and people staying at home more, obviously, and the lockdowns. But then we saw that spike that's indicated there. I think we're starting to see a plateau now, but I would imagine we will continue to track slightly above national as we have done. I think it's a fairly consistent picture.
Okay, thank you everybody. This paper is for noting, so duly noted. Item 4, transition into adulthood. Andy again.
Thank you. So the purpose of the paper is to update around the ambition to provide a transition pathway for all young people who are needing adult social care as they approach adulthood. In section 4, we've laid out the context for working with children and young people with a disability, including the legislation and guidance that governs the actions that we take. That section also highlights a group of young people who can experience particular difficulty in accessing support, and there's a self-description as either autistic or neurodiverse. It very much depends on how people see themselves as to how they like to be described. Section 5 describes some of the work going on across the local authority and our education colleagues to ensure that young people have a pathway into adult services where appropriate. And Section 6 describes how we're going to audit service provision and arrangements for people. I think it's fair to say that for some people with some level of need, we have a fairly clear and prescribed pathways. Often for people with a learning disability, there's quite a clear pathway through. But for people who describe themselves as autistic or neurodiverse, that's not always the case. And what we want is consistency. That's our ambition. So in section 7, we're describing some of the service development around data and intelligence, and also including in that financial planning, as we always have to, as we know, very closely linked service planning to financial planning, and linking different services to work around the young person. And that section also highlights the work that we're planning with neurodivergent young people and adults. As with the previous paper, this one concludes with the links between transition into adulthood work and the aims of our strategy. And broadly speaking, I think for transition, we're not only looking to provide support and clarity for the young people themselves, but it's often the case that we need to provide good information, advice and support for their families, because oftentimes younger people with disability will have a higher level of family care than young people without a disability, and it can feel like a bit of a cliff edge. And so our ambition is to smooth that cliff edge as far as possible so that people have good information, good advice, and we're planning at a sufficiently timely interval in people's lives. So that's the paper, but happy to take any question.
Thank you. Any questions or points, colleagues? Kirsty.
Thank you. I've written this down because this is quite close to my heart. So I have spoken to lots of parents with children who are neurodiverse, and they all experience the challenges when transitioning from children's social care to adult social care. And I also have personal experience as well, because my youngest has autism and Tourette's. So along with other parents in the same situation, we support our children on a daily basis with decisions and life choices. And sometimes we have to deal with lots of different agencies, and it can become very, very frustrating and confusing at times. So I just wanted to say that I'm in full support of the planned entry into adulthood and the recruitment of a dedicated social worker to support the families. So thank you.
Thank you, Kirsty. Anybody else? Nope. Okay, thank you. Again, paper for noting and duly noted. Moving on to the next item, item 5, which is Meals on Wheels.
Thank you. So the purpose of the paper is to update us to the plans for the meal delivery service in the city. The current contract expires in April of this year, so at the end of this month. And we've outlined in section 4 of the paper the current provision for meal delivery in the city, the number of people receiving the service and the cost of those meals. That section also highlights the lack of available providers once the contract expires this year, which gave us the impetus and no choice really but to try and find another way of making sure people have a meals delivery service in Portsmouth. So section 5 outlines the requirements of the tender that we've put out and how that meets our strategy and priorities for the council, and the process of planning the service with local providers, so that element of co-production that we've touched on in previous papers here. That section also gives some detail on how the service will work, and that the aim is to develop beyond the current offer to give residents of Portsmouth greater value. Not necessarily those residents that might need a meal, but thinking about using local resources and how that impacts on the local community as a whole, rather than just those people receiving a service. Section 6 outlines the mechanisms we've got to evaluate the service, and that will be in partnership between our council colleagues, residents who receive the service and the local providers, so a fairly dynamic assessment of how that works. And the resulting report we're intending to bring back to portfolio and also to share that report with the people that receive the service and the providers, so there's a transparency across the piece. Section 7 links this way of commissioning and service development to the aims of our strategy, and the paper concludes with the links to our strategy. When we don't yet have the pricing information, because that will obviously be very important to people, but when we do, we're going to share that as widely as possible, and certainly with spokespeople here as soon as we've got that. We're aiming to firm that up, I think, in the next week or so, and so we'll share that once we have it. That concludes the summary, but happy to take any questions.
Thanks, Andy. An important issue. I'm surprised we haven't got more people that actually use it, but as you say, that may well increase once the new provisions are in. Jeanette.
Yeah, thank you. I was really pleased to see in the service detail to renew this contract about allocating more time for visits, because I think it's really crucial to combat the loneliness, especially through COVID. And I love the idea of the iPads to sort of have a virtual dining room. In a previous life, I dealt with this sort of contract for Meals on Wheels. We had a tasting session. The puddings were nice. The meals weren't so nice. So how do we address the quality of the meals? I'm not so bothered about the nutritional, because I think most people just need a hearty meal. But how do we sort of view the quality of those meals and trying to sort of not do them on the cheap, really?
No, and I think that's a very fair question. I suppose from a couple of perspectives. The first was what we saw during COVID. So a lot of these people that we're talking to about local provision started doing this during COVID because there was a lack of other provision, and so it wasn't necessarily for those people that we'd see as traditional Meals on Wheels customers, if you like. So they've gained their own experience from that. I think the main bit though about the quality of the meals is an active feedback cycle. So because this is very much a piece of commissioning that looks at actively using local community services, those relationships are very local. And this isn't a criticism of a previous service at all, it's an observation, but you're dealing with a national service often, there's very few providers. And so that feedback loop is not going to be as tight or as local, I think, as where we're going to go. So I think it's going to be very active feedback from people about the quality of the food that they have.
Lewis.
Just a quick one on the pricing. I know you haven't got the prices yet. Where it's being done by different people across the city, can I just check it's going to be there's going to be a price point for everyone? There's not going to be depending on where you live, different pricing?
That's certainly our intention. As I say, we haven't got the prices yet, but it would be difficult to be able to manage a variation because we want to give people consistent information. So it would be an intention to have a single consistent price.
Okay, thank you, colleagues. Report is noted. Moving on to item 6. There's no point asking who's going to introduce it, because that's you, Andy. Off you go.
Thank you. So item 6, the purpose of the paper is to update portfolio holder and spokespeople around the inspection of adult social care. Now, we haven't seen a national inspection of adult social care in over a decade. Previous governments did away with what used to be thematic inspections, so I think it's fair to say we would see certain areas of adult social care be inspected. But that hasn't happened for some time. We do still submit performance data on a regular basis, and that's freely available to the public, but it's not an active inspection process. So Section 4 illustrates the relevant legislation which introduces inspection for adult social care, and this is the Health and Care Bill that's currently going through both Houses of Parliament. I think it's in the Lords at the moment, that created integrated care systems, ICSs. Section 5 sets out the action that we're taking in preparation for the inspection process. This won't be an exact science, but we have various tools and support that we can gain from relevant regional organisations to try and prepare ourselves to understand what we believe will be the criteria for inspection, but we don't yet have that published. So the preparation that we do is broad rather than detailed at the moment. Section 6 sets out some of the practice development we're undertaking in preparation and suggests that we bring a paper to update Cabinet when the inspection criteria are clearer. I think the purpose behind that is understanding the impact that adult social care has across the Council as the largest single budget and spender, and the potential implications for getting a positive or negative inspection result. We'd want Cabinet to be aware of that. But take your views on that. And that's all we know at the moment, really. It's a relatively short paper. It's just to put a marker down that we are expecting an inspection. When we hear more about it, we'll share more about it, but just to let you know that we are starting to prepare for it. Whilst you can't really inspect quality into services, it doesn't work like that, but it's an opportunity to evaluate ourselves, the services we provide, and the feedback that we get from the people who use those services. So it is an opportunity as well as something that will become a burden, understandably, because it will be more work to do. So that's a summary of the paper, but happy to take any questions.
Thank you, Andy. Any questions? Lewis, I saw Lewis first, then Jack.
Just more a statement than a question, I suppose, but just the idea of bringing someone fresh from the outside in to almost manage this kind of brings a lot more positives as well in my mind, because at least we're then getting a fresh pair of eyes on what we're currently doing. Even if we are meeting the national framework, they might have some experience of, oh, actually, why don't you do this? And just because we've always done something, it's harder to evaluate, so I think it's a good way forward.
I think that's right, and I think having external view, or somebody who was previously external to the local authority, is also part of that critical friend role that the inspection will bring, because they will be external to the authority as well. So I think we felt that was a helpful thing to do too. And of course there's a lot of work to be done.
Yeah, thank you. I'm a bit concerned about the second to last paragraph, where savings decisions have been made which have affected the capacity of the service to be fair for and respond to inspection. And although a performance manager recruitment would be good to sort of have somebody come in from outside, what it does show is that we don't actually look at the risks when we make savings decisions long term. And how is that going to affect, by recruiting just one person, but how is that going to affect our ability to get that performance data with limited management capacity anyway? And also begs the question that we should be looking at budget decisions a lot more fully and looking at the risks before we take the decisions. And on the budget papers, it has the risk element on it, but they're standard lines, and actually I don't think we look further than that, and we should.
I think, I think that's a fair point, and I think the decisions have been taken over a number of years. I think some of those have been understandable because the change in the burden of inspection and assurance over a 10-year period meant that the council took different decisions. I think we are going to need to build up our ability to collate data and assurance, and we've got another paper on the agenda that talks about information management that's very closely linked to that. Yeah, I don't think I can disagree with that. I think we take decisions at the moment as far as we can see in the future, and those are the best that we think at the time. But yes, we are going to see I would say we're going to see an increased financial burden, certainly, to comply with this.
Anyone else? Okay, thank you very much. Report is noted. Moving on to item 7. Andy.
Thank you. I was going to say my last, you'll be pleased to hear. So this is very much linked to what we were talking about previously in terms of assurance and inspection. So the purpose here is to update you around how we meet our statutory obligations to provide data for existing and to be updated national returns in addition to the inspection criteria that we'll see. And how we use business critical management information to managers to aid them and guide them in making decisions. So Section 4 of the paper sets out the background to the national and local context to management information and the need to meet future demands, both of changing national criteria and the criteria that we'll see as a result of inspection. Section 5 sets out our current challenges, and it's fair to say they're significant around being able to extract strategic reporting from our record system and the need to get to a more automated format so that we can produce reports based on what we're being asked to show, as well as using our data more locally. Section 6 provides detail around the priorities nationally and locally, which means we need to change the way we work, and I've covered some of those really in the previous paper. And Section 7 details the key outcomes from our current project, what we see as the prerequisites for success, and the directorate plan for achieving our priorities. And as with previous papers, it concludes with the links between commissioned services and the aims of our strategy. Since this paper was drafted, the programme of work has been added to the Capital Fund list, though we're likely to fund it currently through the Better Care Fund allocation. So that's just moving where it comes from, but we've agreed we're going to fund that because it is a significant portion of cash to find to be able to do that. So that's a summary of the paper, but happy to take any questions.
Jeanette.
Sorry, it's like the Jeanette and Andy roadshow. Just one question, really. What priority has PCC IT department put on this? Is it a number one priority, or is it down the list?
I probably can't answer that directly because I couldn't give you a score. I think what I can give you is details of engagement. So the way that we've gone about this is to formalise it as a project, so it's got that discipline around it in terms of timeframes, milestones, expectations, and we've engaged with our IT business partner. At the moment, we have a monthly update on that particular project, including all the highlight reporting stuff that you'll be familiar with. We've also engaged some technical specialism because this is also linked to updating our continuing healthcare reporting. So we do have some external information technology resources as well. At the moment, we feel we're getting cooperation. So I don't know what number it is, but at the moment there's good progress.
Okay, thank you very much, Andy. That report is noted, and now you can take a small breather for the last item, which is item 8, COVID-19 intelligence update. Matt.
Thank you, Chair. So slides should be on the screen for you now. So an update on where we are with COVID. As we've moved away from a system of regular testing for many people, we're increasingly reliant on the ONS infection survey to have an accurate understanding of the current prevalence of COVID. So this is a weekly survey of a random sample of people that's been carried out throughout the pandemic. What that shows is in the week ending 26th of February, around 1 in 30 people had COVID-19, so a significant proportion still. So the chart on the bottom left-hand side shows the percentage of people testing positive for COVID in England over the whole pandemic, and you can see that whilst rates have come down from the January peak, they are still relatively high compared to previous phases, and slightly higher in the southeast at around 1 in 25 people. There's a bit of a lag on that data, so we get an update from the ONS tomorrow. They update it every Friday. So it'll be interesting to see what happens because certainly last week they were showing increases in prevalence quite significantly in the southwest of England, and the rates in the southwest of England now are going up quite significantly, as I'll touch on in a second. So with all those caveats about the reductions in testing, the recorded case data on the national dashboard has shown a significant increase in the last week. So cases are up nearly 50% on where they were a week ago. So that's the chart on the bottom left-hand side there. Deaths are still coming down. But hospital admissions are also up nationally. So the picture of COVID being over that you might receive from some of the way it's reported is definitely not the case. And that's in the context in which testing, as you can see on the right-hand chart, is significantly down on where it was before. Locally, what that means is that you can see cases have been coming down from the January peak, but have just started to increase again now. So we've had 909 new cases in the last 7 days. It had dropped down to below 100 a day on average, but it's increasing again at the moment, back to kind of the levels we've been at since from the kind of ending of restrictions in the summer right through to Omicron emerging. It was a fairly consistent picture, and we're back to those kind of levels. So it's still high rates of COVID. This map's from last week's report. It'll be updated again later today. But again, you can see there kind of band of high rates on the, across the south of the country. And the latest picture in Portsmouth, our 7-day rate is at 423 per 100,000, so up 16% on where we were a week ago. You can see it's up in England and the southeast as a whole. And Torbay, currently the highest rate in the country, but kind of indicative of what's going on in the southwest of the country. They're up 39% on a week ago, and I would expect to see those kind of rates of increase spreading across other parts of the country in what's a fairly normal pattern now. What's interesting is that those rates have really been increasing in all ages. So this is the local data on age breakdown of case rates. You can just see on the right-hand side of the map chart there the uptick in all those age groups in the most recent week. And it's again a similar picture nationally. So what we don't yet have is a clear understanding of what's driving that increase. I think there are a number of factors at play, including the more transmissible version of Omicron, BA2, obviously the impact of ending most restrictions in terms of increased people mixing. There's some suggestions that the increase in admissions in particular is driven by waning immunity in older populations who had their boosters first, and that will be partially addressed by the spring booster programme. And there's also a suggestion that we've got nothing more than anecdotal evidence around at the moment, but that there's a kind of population of people that have been shielding really strongly throughout the whole 2 years of the pandemic because they're vulnerable, and that population is now coming out of shielding as a result of national policy changes and the fact that we're 2 years into the pandemic and they're boosted. So there's a set of people who've really not been exposed to the virus before that are now being exposed and are vulnerable, and that may be driving partly what we're seeing in terms of hospital admissions. We still do the school age breakdown, bearing in mind that secondary school testing is not carried out in asymptomatic secondary school testing is not carried out in the same way since half term. But again, that increase in cases has been seen in the younger age groups as well as the older ones. Vaccinations, not much to add really. We're kind of stuck at just over 80% of people that have had their first dose. Incremental progress really beyond that. But yeah, hospital admissions. So the inset chart is the local data on hospital admissions, and you can just see there that this is COVID-related admissions, a significant spike over the last week or so. So the national data is still saying 109 patients in PHU with COVID. It's more like 150 at the moment. So it's been a bit of a jump. Not unexpected from the work we'd done modelling what we expected to happen as a result of easing of restrictions, etc., but causing significant pressure in the health and care system. The positive news is that the lower severity of Omicron and effective treatments, etc., still plays out in terms of significantly lower mortality. So deaths each week, shown on this chart, for all causes in Portsmouth. The right-hand side of the chart shows the most recent weeks, and the green diamonds is the 5-year average of 2015 to 19. And you can see that throughout 2022, we've been significantly below what we'd normally see in terms of deaths, including COVID deaths for this time of year. So lots of COVID around, in summary. Not quite sure what's going to happen next, but it definitely hasn't gone away. It is causing pressure in terms of hospital admissions, but it's not translating into the most severe outcomes in terms of either ICU use in the hospital or deaths. And I will stop there, but happy to take questions on any of that.
Thank you very much, Matt. Sorry, colleagues, any questions? Jeanette?
Yeah, with the stopping of testing and any mandatory having to report, how useful will this data be going forward, and when would you see that actually producing this sort of data is not going to be useful at all? Yeah,
it's a very good question. I mean, the ONS infection survey I think will give us that kind of continuous measure that isn't affected by changes in testing policy. So we'll use that as a checkpoint. But there's not much point us reporting that locally when it's reported nationally by the ONS, and just replicating their report isn't adding much value. What we've said is that we will review and potentially end the weekly updates on the council website of our COVID rates, based exactly on the point you just made, that the case rates based on testing are increasingly unreliable as an indicator. But even, I think, in the short term, they're still useful in telling us something. We just have to interpret them with more caution. So despite the reductions in testing, we're still seeing an increase in reported cases. Now that suggests that probably the actual increase in cases is higher than we're seeing. So yeah, it just requires a bit more caution. But yeah, we are looking to transition away from public reporting of case rates on that basis, with the sort of fallback that the national dashboard still reports all those, so it's still available for people that want to see it.
Thank you, Matt. Anyone else? No? Okay, well, thank you for that. Colleagues, this, just to wrap up, this is our last portfolio meeting of the municipal year. A year, I think, in which we've obviously still had to deal with COVID, which, as Matt's just highlighted, is still ongoing. Before we finish, I'd like to go just some personal thanks. First of all, to the officers. There's only 4 of you here, but the 4 of you here, you can have the thanks. It's been very useful, invaluable, in fact, to have your support over the course of the year. So thank you very much indeed for that. I certainly, this being my first year of holding the portfolio, I wouldn't have been able to do it without you. Same goes to my 3 opposition spokespersons. I think we've worked fairly well despite our political differences. If I can say that as a wishy-washy Liberal in the middle. You've each given, I think, excellent input throughout the course of this year, and as I think I've said in emails before, a credit to your respective parties. So thank you all very much. If I had a cap, I'd doff it, but I don't have a cap, so my words will have to suffice, and let's see what May brings. Thank you very much, everybody. End of meeting.